Hello everyone. Today I am going to talk about estrogen hormone, xenoestrogen and estrogen dominance. How these estrogen dominance and xenoestrogens affect our body functions. Let's see today. And I'm Dr. Geetanjali Gariema. I'm a gynecologist, fertility expert and reproductive endocrinologist from Mumbai, India. Estrogen is a natural hormone produced in our body. It is one of the major sex hormones. Our sex hormones manage our reproduction, the development of different sexual characteristics, and sexual motivation. Some of the main hormones are estrogen, progesterone, and testosterone. Estrogen and progesterone are major female sex hormones, while testosterone is a major male sex hormone. Still, all three of these are produced in both men and women in different quantities. So, how these hormones get out of balance? Our sex hormone levels can change naturally during different stages of our life, be it at puberty or in reproductive age group, in the middle age or during menopause or andropause in case of men. But they can also be thrown out of balance by our diet, lifestyle, and our exposure to external toxins. Estrogen is a vital reproductive hormone. It supports the reproductive organs and their function. It has an important role in bone growth, blood clotting, and reproduction in men and women. Let's see what is the estrogen dominance and how it affects our body. As we have seen that estrogen is a primarily a female sex hormone. However, men also produces a little amount of it. When more estrogen is produced in comparison to progesterone hormone, which is another female sex hormone, then it is labeled as estrogen dominance. Estrogen is the hormone that regulates menstrual cycle in women. So, what are the symptoms because of this estrogen dominance? Let's see. Hair loss can be there, mood swings, depression are few of the symptoms because of estrogen dominance. Heavier periods can be there. Excessive premenstrual syndrome is seen because of this dominance. Bloating can be there, weight gain can be there, breast tenderness can be there. All these are associated with PMS. Then low sex drive is closely associated with this estrogen dominance. Aging symptoms and other reproductive disorders can be because of these higher levels of estrogen. So, what happens when there is too much of estrogen in our system? You can experience bloating or you can experience puffiness. Puffiness can be seen on the face also. You feel irritable or experience mood swings. You can have heavy or painful periods. You can gain weight, especially around your hips, butt, and thighs. There can be difficulty losing weight, or sometimes you can develop fibroids in your uterus because of these extra estrogen levels. Now, let's see xenoestrogens and what are they? Xenoestrogens are estrogen hormone mimicking compounds which are not produced by our body. These are the compounds which are structurally and functionally related to our human sex hormone 17 beta estradiol. They bind themselves to estrogen receptors and block the action of natural estrogen in our body. So, xenoestrogens are endocrine disruptors, which are the external chemicals that alter the normal function of our hormones. Our endocrine system releases hormones which signals different tissues and organs, telling what to do and when to do it. These chemicals from the outside, like makeup, plastic containers, chemically laden fruits, vegetables, and food items, enters in our body. Then products such as creams, lotions, soaps, shampoos, perfume, hairspray. And room deodorizers often have chemical structures which are similar to these estrogens and indeed act like natural estrogens in our body. So xenoestrogens are a subcategory of endocrine disruptor group, and when there are in excess quantity, it causes estrogen dominance. So what are the effects of these xenoestrogens in our body? They causes conditions like breast cancer, diabetes, and obesity. These three are common in men and women both. Specifically in men, it can cause prostate cancer and testicular cancer. In women, early onset puberty can happen. Infertility can be there because of these excess estrogens and xenoestrogens. Endometriosis can develop and miscarriages can happen. Let me tell you a truth bomb about these xenoestrogens. These xenoestrogens are non biodegradable. So once they get stored in our fat cells, there is no way that they can come out of our body. So minimize your personal exposure to these xenoestrogens.